Well, welcome everybody for another Zoom call. And we are going to talk about some questions that came in first, and we'll open it up for questions. So let's go right to that. One question that was on the board and also came in about pulsing supplements. So what is pulsing a supplement goes? Or a medication. So when you're going to do something in a pulse method, that means you're going to be on for a period of time and off for a period of time. And has been talk in the last couple of years that there can be benefit to pulsing certain supplements. I would agree with that completely. Matter of fact, I had Dr. Kelly, when she was in the office with us, do a seminar or a little video on this a number of months ago, and we did post it on the Facebook page, so please look at that. Or I think we post a link to it, but you can find it on our YouTube account if you put in the questionnaire thing about pulsing supplements, Dr. Kelly, and you'll see it. There can be benefits to pulsing certain supplements. There can be benefits to only utilizing certain supplements when you need them also. So, but when we talk about cancer patients, is it right to pulse your supplements that are treating necessarily you're using specifically to help knock down the cancer? My belief is you don't have to. So I don't think that you need to do that. I don't think that in itself is going to make the cancer, by you pulsing it or not pulsing it, is going to make the cancer less resistant to developing an immunity towards that supplement. So I don't think that's going to make a difference. Some of the detox supplements, I think there can be benefit to pulsing those. It depends on where you're at with your care, though. So everybody's so different with that I would never say that everybody should be pulsing their supplements. But I would never say that some people wouldn't benefit from doing so. I personally pulse my supplements, but not on purpose. Meaning, there's some days I wake up and I'm really busy in the morning. I forget to take my supplements in the morning, and then I might forget in the afternoon if I get home and I have to cut grass or do something like that. And it's almost always on days that I'm feeling really well. So if I'm reminded of my symptoms, so if I have a lot of pain in my abdominal cavity, which is where the majority of my pain is, then that will remind me to take my supplements. But typically, if I'm really busy, there can be a day that I forget. So really, it's maybe once every 2 weeks do I go a whole day and not remember to do it. More often, maybe once a week, I'll go all day and go, oh, gee, I didn't even take my supplements. Now it's 4 o'clock and I take them. So there's that. Is that the right thing to do? Is it better to stay regular? Yes, I do believe so. I think I feel better when I stay regular, and sometimes if I'm feeling better, then that's when I do start to forget things. So, but again, my situation is, what I recommend is that you not have your mind on your cancer all the time. So I'm not thinking about my cancer as much as I can possibly not think about your cancer. So I'm trying to keep my mind busy. I'm staying very active, and it's just a matter of forgetting for me. I would say that if a person is a Lyme patient, pulsing their supplements that's where pulsing their supplements can have great benefit. So if you're trying to kill a biotoxin, pulsing your supplements, that's where that really shines. With a cancer, that's a different story. I wouldn't say pulsing is an important thing to do by any stretch of the imagination. Next question series we had on different types of fasting, and we've talked about multiple different types of fasting on our website and in our videos. And I just wanted to kind of talk about it because several questions came in about that in kind of like one little piece of a video here. So what are the different types of fasting? Well, a person could do a full water fast. That's what you usually think of a person as doing a fast. So that means they're not eating anything. They're not drinking anything but water. So they're on a water fast. They could, historically do that for 1, 2, 3, 4 days. There's good and bad to it. So if a person has cancer, though, remember what I've said about this, we don't want to go on a full water fast because all the research shows that after 24 hours of full water fast, your IGF-1 levels start to rise. And that can be good for anti-aging things, like I want to just clean out and be healthy and do the right thing. But that's not what we want for cancer patients. So we don't want cancer patients to go on fasts longer than about 20 hours, really, just to be safe. Because our goal is to make sure that our IGF-1 levels are dropping. That's one of the purpose of the fast for a cancer patient. So you're decreasing this one pathway that we've spoken about a lot, your KRAS pathway, so that it'll decrease growth. And that's why you want to go on a fast for a cancer patient. You want to decrease growth. And so the thought is, well, I'm just not going to eat, so then my cancer won't be fed. So I'm going to go on a 40-day fast. Jesus did it. I can do it too. Rah, rah, rah. Well, that's not going to be good for you, really. Jesus wasn't dealing with cancer at the time, and he had different reasons for going on his fast. So for a cancer patient, I would not recommend to fast more than 20 hours. So we don't do water fasts here. Fasting mimicking diet is another way to fast. So a fasting mimicking diet gives you all the benefits of a long water fast, like a 5-day water fast, but a fasting mimicking diet is you're still eating a very specific, scientifically developed number of calories and the type of calories each day for 5 days, where you'll get all the benefits of a 5-day water fast: lowered IGF-1 levels, lowered KRAS, lowered growth. Fasting mimicking diet is the biggest thing we promote as far as trying to get a hold of a cancer that's growing rapidly. Doing a 5-day FMD, fasting mimicking diet. It comes in a kit, and one kit takes you through the whole 5 days. And yes, you will be hungry during those 5 days, but you've got to follow the diet exactly the way it's laid out in this kit. And more information on that, we have videos just on the fasting mimicking diet and a whole bunch of information on our website on this. But that's the most recommended one that we use. Well, I should say really the intermittent or the time restricted fasting eating is really the most common one, because we really recommend this as beneficial for everybody. And that is really picking a time during the day, which is your eating window. So in this little skew here, it looks like between 12 o'clock and 4 o'clock, this person is eating. And then they're fasting for 20 hours a day, and then this is their eating window. So it's many times that's what the referral is what is my eating window? Well, I do this a lot. So I'm really good at not being hungry all day long. So if I come to work and I'm busy taking care of patients, writing things, I don't even think of food. And so I have no trouble after I'm done eating at 8 o'clock the night before and it's time to go to bed, that not eating again till I get home at 6 o'clock. So typically my eating window is really from 6 to 10. And some people will say, well, that's horrible because then you're going to bed on a full stomach. And that's not really the best for weight loss. And I'm probably, a wonderful living testimony of that truth. But that's not what I'm doing it for. So I'm doing it to keep my IGF-1 levels down, keep my growth of cancer down, because I'm decreasing those metabolic pathways. So I'm getting the benefits of a fasting mimicking diet, doing this on a daily basis, but I don't do it every day. So you would get the benefits of a fasting mimicking diet if you did it daily. I don't do this every day. I only do it maybe 3 times a week, but that really helps me. Would a fasting mimicking diet be probably better and would really lower those levels down? Yes. So I've done the FMD multiple times. That's 5 days. So They recommend that you do it 5 days, 3 months in a row. So one of the weeks of every month, you're doing the fasting mimicking diet. And then you don't have to do it again for 6 months or a year. Um, we have some patients that will do this every 3 months. We have some patients that will do it every 6 months. I've done it since we introduced the FMD a year and a half ago. I've done it 5 times, so I probably should do it again. So those are really the 3 main types of fasting. These 2, the fasting mimicking diet and the time restricted eat, are the 2 that we recommend to almost everybody. And the time restricted eating is probably the easiest one to do of all of these. It's just picking a window, and once you get used to that, you're holding to that window. Now, we allow our patients to take their supplements and everything in this window as well. So let's say you're going to only eat, as in this diagram, between noon and 4. Can I take my morning supplements? Yes, you can. So your supplements are very important. So you're taking your supplements any time you need to be taking your supplements. It's just that you're consuming food in that window time. Okay, so with that, we will open it up for questions. I will unmute everybody and feel free to chime in.
I have a question.
Uh-huh.
Dr. Connors, this is Johnny Kozad
Yes.
from Texas. I recently heard about some interesting information, and you may have already heard about it, but I would just like to kind of throw it out to you as far as the cause for cancer and being exposed to this toxin, or it's a fungus called Sclerotium rolfsi.
Yeah.
And some of the effects are toxic blue cyanofilamentous bacterial. Some of that stuff. Anyway, I was kind of wondering if the fungal programs that I think I was given by the clinic, does it cover that type of fungus?
It covers all the frequencies of fungi that are known.
Okay.
And there's some, I'd have to look on yours again, I'll make sure.
Okay.
I'll let you know if there isn't, but I'm almost positive we put sweep sets on yours,
All right.
which would cover anything in between there. So you should be fine on the fungal. Now, if you want to run separate fungal programs, you can run the ones that are already in the program
Okay.
under, I think it'll be alphabetically under fungus.
Yes, sir. Okay. Thank you very much.
You bet.
Dr. Connor,
Uh-huh.
I'm still having a difficult time with my energy levels. I wake up in the morning and need to go back and lay down about 45 minutes after I wake up, which doesn't fit in our lifestyle very well. I'm pretty sure it's an adrenal problem, but about 1 o'clock in the afternoon, I start getting energy. I just don't know what else to do.
Okay, so we really should probably run what's called an adrenal stress test on you,
Okay.
which is a salivary test where you take your saliva sample 4 times in a 24-hour period, and then you can see what's called the cortisol rhythm.
Okay. You've done that before, yeah.
Okay, so it's a very common test. It can tell if your cortisol rhythm is just way out of whack. Then we know you're dealing with a primary pituitary adrenal issue, and then you could take corrective measures on that.
Okay, so just call up there and get it.
Yeah, I'll
Okay.
tell the girls we can pull it and get it ready for you.
Okay, thanks.
Yeah. Let's talk a little bit about that also. So what are some reasons for fatigue in a person with any disease or with cancer? So obviously a person can have fatigue with cancer. The most common reason for fatigue with cancer would be um, if it is growing an active cancer is going to be just the cancer is just draining the person's energy. So if the person has cachexia, meaning that the cancer is breaking down muscle, and that would be evident in visual, I don't have any muscle mass anymore, or my strength is weakening, and I'm losing several pounds a week. So that's the definition of cachexia. And with cachexia, that's going to drain your energy because your cancer is just turning your muscle cells into glucose. And then you can have fatigue depending on what type of cancer you have and what organs it's reflexively affecting. Um, and like colon cancer, you're not absorbing your nutrients as well. That could cause fatigue. Cancer in the abdominal cavity, anywhere, can reflex back to a decreased adrenal function, and that can cause fatigue. So there's multiple reasons for that. Also, when a person can have primary pituitary adrenal issues. That's what was discussed by our last question, and that is just because of prolonged stress for any reason can affect the pituitary adrenal axis, and then you just aren't getting the adrenal output at the time that you should be. That's why you do that cortisol rhythm test, because there should be a normal rhythm of cortisol secretion. It should actually be highest at about 2 o'clock in the morning, and then it drops down slowly at the end till the end of the day. So from a normal adrenal function, you have it should not be as far as energy wise. A person should be able to wake up and get out of bed and have normal energy, and then they can fatigue at the end of the day. So there's different issues with the adrenals that we'd want to look at with that function test. Okay, unmute everybody again. Any other questions? We're all good? All right, well, we'll get this recording posted up. And thank you for participating. And again, always email your questions in if you have questions that come up to clinic@gmail.com, and just put in the subtitle or the subject line Zoom call question, and we'll get to it. All right, thanks so much. Bye-bye.